Chances are you've heard of Ativan. It's one of the most prescribed medications out there for things like anxiety and trouble sleeping. It's a go-to for doctors looking for something that works fast. But, like with a lot of things, that quick relief, it comes with a much more complicated story.
Ativan really sits at this fascinating crossroads. On one hand, it is an incredibly effective medical tool. But on the other hand, it comes with some of the most serious warnings the FDA can possibly issue. So which is it? Is it a prescription for calm, or should we be concerned? Let's get into it.
Okay, so first things first, what exactly is Ativan? Well, the generic name is Lorazepam, and it belongs to a class of drugs called benzodiazepines. You'll probably hear people call them benzos. And their main job? To work fast to relieve anxiety and help with sleep problems tied to that anxiety.
So why would a doctor reach for this specific prescription? Well, we're not talking about just mild everyday stress here. Ativan is a really powerful medication, and it's meant for specific approved conditions where the fact that it acts so quickly is a massive advantage.
So the FDA has given it the green light for managing anxiety disorders and for short-term relief from insomnia. But you can see its real power when it's used in some pretty critical situations, like stopping a life-threatening seizure in its tracks or sedating a patient right before surgery. This really shows you it's intended for serious medical needs.
So how does it work? The science is actually pretty straightforward. Your brain has this natural chemical called GABA. Think of it like the brain's brake pedal. It slows things down and creates a feeling of calm. All Ativan does is give GABA a boost, helping it do its job even better. And that's why it works so fast and feels so effective.
Okay, but this is where the story takes a really sharp turn. Because for all of its benefits, Ativan carries some major risks. We're talking risks so significant that the FDA has slapped its highest level of alert on this drug. Yeah, Ativan comes with what's called a boxed warning. And let me be clear, this is not the fine print you skim over. This is the FDA's biggest, boldest safety alert, and it's there to make absolutely sure that doctors and patients understand the huge risks before a prescription is even written. So what is a boxed warning exactly? Sometimes you'll hear it called a black box warning. It's reserved for drugs that have risks of serious, even life-threatening side effects. They literally put it in a black box right at the top of the drug's info sheet, so you absolutely cannot miss it. It's a giant red flag. And Ativan has two of these. First, if you combine it with opioid medications, the results can be fatal. It can dangerously slow down or even stop your breathing altogether. Second, there's a serious risk of physical dependence, withdrawal, and addiction, and here's the kicker, this risk is there even if you take the medication exactly as your doctor told you to. Now, it is so important to understand the difference here between dependence and addiction, because they're not the same thing. Physical dependence just means your body has gotten used to the drug and needs it to feel normal. If you stop, you'll get withdrawal symptoms. Addiction, on the other hand, is a behavioral thing. It's when you can't stop taking the drug even when it's clearly causing harm in your life. With Ativan, that physical dependence can happen fast, and it can really set the stage for addiction. And that brings us to a really critical number, 4 months. Why 4 months? Because that is the longest period of time that the safety of using Ativan for anxiety has been properly studied. Taking it any longer than that, well, that's basically uncharted territory. It just hammers home what doctors agree on. Ativan is meant for short-term use, not forever. And that whole short-term idea is pretty common for all benzodiazepines. So how does Ativan actually stack up against other big names in its class, like, say, Xanax and Valium? Let's do a quick side-by-side. So at a glance, they look pretty similar, right? Ativan and Xanax both kick in really fast, usually within about 15 to 30 minutes. The key difference here is the peak effect. A faster peak, like you get with Xanax or Valium, might be better for stopping a sudden panic attack, but Ativan's slightly slower, more drawn-out effect might be better suited for managing more generalized anxiety. Okay, so this brings us to what's probably the most important part of this whole conversation. With all of these risks, how can anyone use this medication safely? What are the absolute must-know rules if you or someone you care about is prescribed Ativan? The single most vital safety rule is right here in this quote. You cannot, under any circumstances, just stop taking Ativan cold turkey, especially if you've been on it for a while. The withdrawal can be absolutely brutal. We're talking severe anxiety, tremors, and even seizures that can be life-threatening. So the only safe way to stop is with your doctor's help through a process called tapering. It's not complicated. It just means your doctor will set up a schedule to slowly, gradually reduce your dose over weeks or maybe even months. This gives your body time to adjust and helps you avoid that severe withdrawal. And beyond the tapering, there are a few non-negotiable rules. Never, ever mix Ativan with alcohol or opioids. Don't get behind the wheel of a car until you know for sure how this drug affects you. And always, always stick to the dose your doctor prescribed. Remember, this is a Schedule IV controlled substance for a reason. It demands your respect. And all of this leaves us with one big final question. Ativan is the perfect example of this dilemma we have in modern medicine. Powerful, life-changing relief on one side, and profound, serious risk on the other. It just goes to show how incredibly important it is to be an informed patient. So how do we find that right balance? That's not just a medical question. It's a deeply personal one. Thanks for joining us.